Hey, I want to talk today about neck pain. Now, neck pain is super common, and often there's some stress component. Almost all of us can recognize, oh, I had a tense day, I have a tension headache, or at least we understand that concept. I got embarrassed and I blushed. I mean, here are some physical things that happen to us related to our emotions. Neck pain's often the same. A lot of us hold tension or stress in our neck, and we recognize this. And yet, when you go to a doctor with neck pain, they almost never ask about how's the stress in your life? You think you're holding tension there? We don't ask that question because now we're starting to get into that mind-body issue. Like, could your brain be causing this? Or could your stress level be causing this? Or why are you such a wimp that you're letting your stress level bring you to the doctor or something like that? We're getting into this weird territory. We don't know how to approach it, and so we just don't even ask the question. We don't ask it because we don't know what to do with it. Now, chronic neck pain is a complex and nuanced topic. There are all sorts of different causes of neck pain. Everybody's different. I don't want to tell you what to do about your neck pain. I'm putting in a little disclaimer here. This is not medical information about you. I'm just giving you a framework through which to look at your neck pain, and then you can decide if this is right for you. And I'm talking to people who have chronic neck pain. This is long-term stuff, long-standing neck pain. I'm not talking about a new acute problem. Get it checked out. I'm a fan of Western medicine. Do your due diligence. But once you've done enough due diligence to know that you don't have, bone cancer or something like that, and to know that nobody's saying, get on my operating table right now, you're in deep yogurt, you're about to die. If doctors and various clinicians are trying all sorts of different things, but nobody's getting excited that you're in mortal danger, then I hope this video will encourage you to take a little bit different approach to how you're looking at your neck pain. And I want to just tell a story about a patient of mine that I saw many years ago, way before I was doing any mind-body stuff. I'm just a primary care doctor. And a patient who I'd known for several years comes in, he's in his 70s, and he's telling me what had happened several weeks earlier. And he says, several weeks ago, I had a slip and fall on the ice, and I kind of got a concussion. My head was killing me. I went to the ER, and they started doing some imaging. They took some pictures. And at the end, they said, okay, you don't need to stay here, but you should see a spine specialist. We're seeing some stuff in the spine. It took me 2 or 3 weeks to get in with this guy. I'm seeing this neurosurgeon who does spine stuff. And he walks into the exam room. I never met the guy. He walks into the exam room. He says, I just looked at your spine MRI. You should have been on my operating table yesterday. And he started describing all the deep, terrible problems that was going on and how my spinal cord was about to be severed in half and I could become a paraplegic. And you know what I did? This is a patient talking to me, telling me this story. He's looking at me, he says, you know what I told him? I told him this. I said, that's interesting, Doc, because 10 years ago, I was in a fender bender in the Bay Area where I was living at the time. And I went to the ER because something was out of whack, and they did a bunch of imaging. They told me the same thing. They said, hey, you can go home, but you should see a spine specialist. It took me a few weeks to get in with the guy, just like it took me a few weeks here. And that guy walked into the exam room just like you did. He said, I just looked at your MRI. You should be on my operating table tomorrow. So he told me almost the same thing you're saying. And I told him, well, I'm feeling better, and so I didn't do it. That was 10 years ago. And I'm going to tell you the same thing. I'm feeling better. My neck, took me a few weeks to get in here, and I'm doing okay now. I think I'll put off the neck surgery. Now, I followed that patient for the next several years. He did fine. But the point of the story is that the MRI can cause us to do all sorts of things, can make us go, oh, this is the problem. And yet this guy did fine for many, many years with an MRI that 2 different surgeons thought, oh my gosh, I should get in there. The real point is that his exam was completely normal. These docs were going to treat his MRI. You don't treat an MRI, you treat the patient. And many, many people have MRI abnormalities. This is 3,300 people who had no neck pain. This was published in the American Journal of Neuroradiology in 2015. And they just asked these people, can we take a picture of your spine? And they found that in these people who have no pain, here's people in their 20s, well over 30% of them have degenerative discs and all sorts of other problems in their back. And you get into the 60s and 70s, now you're talking pretty much everybody has something going on. So all of these things are real, and they sound horrific. You may have heard words like spondylosis, foraminal stenosis, spondylolisthesis. That sounds horrible. It took me, a week in medical school to learn how to say that. This must be a terrible disease. facet arthritis, the central canal stenosis, which is what my patient that I just told the story about, he had a narrowing of the central canal. No, these things can be potentially bad. You suddenly narrow that canal, you can pinch the spinal cord, you can become a paraplegic. But the human body is really an amazing adapter of things. And for most people, when it happens gradually, they're okay. I'm not telling everybody, I'm not telling you what to do. Get your things checked out. But if your exam is normal, you may want to get a few different opinions if somebody's telling you this is wrong with your neck and this is the reason for your neck pain. Because what we're finding out is that an MRI is a great way to make sure that you don't have a cancer or a spinal cord tumor or an infection or a broken bone that's not healing or a bone fragment floating around or something. It's a terrible way to tell me what's actually causing your neck pain. So if all kinds of normal pain-free people have similar imaging findings to the ones I have, where's my pain coming from? It's coming from your brain. Specifically, it's coming from the autopilot part of your brain that you have no direct control over. And this is what's so important to understand, that there's a large part of your brain devoted to running the body through a network of neurons called the autonomic nervous system. Right now my head is upright. And I don't know how that's happening. I can override it. But all day long, somehow magically, my head stays upright. That's my autonomic nervous system holding some tension in some of my neck muscles. I'm not even sure which ones. It's doing the same thing in every bone, muscle, ligament, joint, tendon in my body. And so there's a part of the brain running my body, holding on to tension. And this is the area we need to turn our focus to. I see a lot of people then who say, okay, so I've got some findings that other people have, but you still don't get it because my pain's real. I mean, I can feel it. I got this muscle tension here, the tight muscle. I can feel the tightness. My physical therapist can feel it. Anybody who touches me can tell me this is a really hard muscle. So, and then not only that, I get a procedure like a dry needling or a massage or something, and we can all feel it. I can feel it. They can feel it, that the muscle actually changes and calms down. So I got a physical problem. My response to that is, well, if you had a tight muscle and you go in and somebody does something and you walk out and you feel better and you're permanently cured, yeah, that helped it get better quicker. But if it keeps coming back, if you walk out feeling better, but then this sensation keeps coming back, the tension, the pain, the muscle spasm, that's your autonomic nervous system holding on to tension in your neck. So if you're somebody with long-term neck pain, a lot of muscle tension, you've seen a lot of doctors, it screws up your day, screws up your night even, might be really messing up your life, or even if it's only moderately messing up your life. But as long as you've done the due diligence, then I hope this video might encourage you to take a little bit different look at things and turn your attention away from the neck or the specific body part and towards the brain and the nervous system, which is continuing to hold on to tension. And when you turn your attention there and you use some of the mind-body tools to calm down the tension in the nervous system, you might be very surprised to see what happens to your chronic neck pain. If you're new to mind-body medicine, I've put some links in the description below that can help you get started down your own path to looking into this. You might check out my website. I offer an online pain class that has helped hundreds of people get better. You might want to check that out. There are all sorts of places you can look for this. I really encourage you to start looking into this because this is something that you can do to change your own health. I like to say in mind-body medicine, we're using the conscious mind to change some of the seemingly automatic processes going on in the body. This is super empowering work. A lot of people say, hey, I came in with neck pain and other things are getting better, from insomnia to stomach problems to whatever. So whatever your problem, if you do have one of these chronic problems, I hope you'll start checking out this new way of treatment. I'm Dr. Brad Fanistel at BoulderMindBodyMedicine.com. Thanks for watching. If you like this video, hit the like button. If you want to see more videos like this about all sorts of different topics, please hit the subscribe button, and I'll see you next time.